Good morning. So today we have a patient in her mid-30s and she previously had a tummy tuck, but now she wants to get more definition on her abs, more definition on her love handles, and more definition of her arms and inner thighs. So what we're going to be doing is VASER high definition. That's going to be sculpting of the muscles of the anterior abdominal wall, the six-pack, as well as the arms. We're going to give her well-defined biceps and triceps and deltoids. So give me about 90 minutes on the arms, and our arms are going to be ripped. It's going to look great. I'm also going to be working on her superior iliac crest, which is the love handles, the sides, and also going to be doing liposuction on the inner thigh and around the knee. So this patient had previously had a tummy tuck in here, and she has a nice flat abdomen, but she wants more. She wants more definition to her abdomen. She wants her muscles to show through. So what we're going to be doing today is called VASER, okay, Hi-Def Liposuction of the abdomen as well as the arms. She wants more definition to her arms. So on the abdomen, what we're going to be doing is liposuction here centrally to give her this linea alba line. We're going to be doing liposuction here laterally, the semilunaris lines. I'm also going to be doing liposuction across like that. I'm also going to be doing liposuction in the superior iliac crest and the inner thighs. So on the arms, what I want to do is I want to really define the deltoids. So I come in here on the inferior portion of the deltoid, chisel that out with the VASER. Also with the VASER, again, we're going to chisel this out. From the belly button down, we're going to remove all the fat in there and really sculpt inner waistline here by really bringing that in with the VASER and chiseling that out. I'm also going to be doing some liposuction in the inner thigh and around the knee area in there. So on the arm lifted view, you can see I want to chisel out the deltoid in there to really show off her deltoid. I'm going to do a little bit of liposuction distally there, and then we're going to clean up a lot of the triceps fold in there to really give her ripped and really muscular arms in there. She wants a really defined athletic arm as much as possible. You can further see on the side, I want to really chisel out this deltoid. This is the deltoid above, okay? This is the biceps anteriorly, this is the triceps posteriorly, and I want to really chisel out that triceps and the biceps insertion right there, as well as the deltoid with the VASER. And by doing the liposuction in these targeted areas, we're really going to get her some athletic arms. So on the back side, what I really want to do is I want to chisel out this deltoid right in there, just like that, both sides, of course, both sides. I want to chisel out the definition between the biceps, that raphe or that line between the biceps right in there. And then I really want to get rid of some of the hanging skin and fat in the posterior aspect of the triceps in there.
Now I'm sculpting out the triceps region, and this does a couple of things. One, it melts the fat, and I can really get in close to the muscle without causing too much trauma to the muscle or blood loss. And then I can really sculpt out the muscles using the VASER. With traditional lipo, it's not as easy, and I don't think you get as good results as you do with the VASER. 2.5 minutes on this area. The time on the VASER really depends on how much tumescent solution you put in there, your comfort level, and the amount of fat that's there. And it's sort of a gentle motion here with the VASER. People say it's like playing the violin. I don't play the violin, so I'm not quite sure what that means, but it's sort of these gentle strokes, not like the forcible strokes with the lever. We've got a couple of seconds here. And I'm comfortable with that amount of time. And now I'm going to sculpt out the inferior or posterior insertion of the deltoid muscle here. These are the deltoids, triceps, biceps, and now we're going to really sculpt out this portion with the VASER. Come to the other side. These are key maneuvers in here to really sculpt out the arms. She wants as sculpted arms as we can get. So she wants the most muscular arms I can make for her. And I think she's going to get an excellent result here. We've got to be pretty aggressive with the VASER. We've got to be pretty aggressive with the liposuction. But I think she's going to get really, really good results. She hasn't lost so much weight, and she has good genetics and good age. that the skin should contract, as opposed to, say, somebody who lost like 100 pounds or more, stretch marks, etc. And those patients may probably do better with a arm lift or an arm reduction, or actually excising skin as well as fat. This is a fat-only procedure, that's the liposuction, but we do get a pretty good amount of skin recoil with the VASER. These are plastic port sites. They prevent the skin from being burned from the VASER, because the VASER gets really hot. And there's also friction, so this minimizes the trauma to the skin. So I've done 2 steps already. I've done my tumescent where I put in the fluid, and then I did my VASER here, triceps and posterior aspect of the deltoid. And now I'm going to go into traditional liposuction and suck out this fat. You can see the fat that's just kind of dripping out. I'm pinching here. I'm just pinching pretty much skin on top of muscle or fascia. And not much fat left here now. So she's got pretty much skin on muscle. That's going to give her an excellent result. Posterior aspect of the tricep. Pretty much we've done this area, and you can see the muscle contouring starting to take shape and bulge out. So I'm going to come in from this other port. Now again, I'm just cleaning this area up, the posterior aspect of the triceps, just from a different angle. Make sure we've swept out all the fat cells in here. I don't want to do too much around the elbow. You can oversuck the elbow quite easily. Get into the ulnar nerve, cubital tunnel, etc. We want to avoid that area. Are we on assumption? Good. Now, I'm going to work on the deltoid, which is this muscle. Deltoid is the shoulder muscle. It comes across the shoulder like that. And you can start to see the shape. You see how the shoulder comes here and now it dips down. And then we go into the biceps and the triceps. So I'm just defining that intersection a little bit more, chiseling out the fat from the muscle underneath and leaving her just with fascia attached to skin. And that gives you that ripped, muscular arm look. And that's exactly what you're looking for. So I do it from the back side here, the back side of the deltoid. And then when I have her flipped over, I'll do it from the front side. So it's a 2-step approach. You can't get this backside if you're just doing lipo from the front. You have to turn the patient face down, but then you don't get a good arm sculpt. So I turn the patient on her side, so I think this is the best position for this surgery. And then for all you plastic surgeons out there watching, what I like to do too is I do a little bit of delineation between the biceps and the triceps, so I just go down here a little bit, not too much, just to define that intersection. That's sort of I call the advanced course. And I have given some instructions to other plastic surgeons on how to do this VASER Hi-Def stuff. So this is how we do it in Beverly Hills. So that took me half an hour to sculpt out the triceps and the deltoid. She's going to get rocking arms here. Now this would have taken probably a good 2 years in the gym. So, and then the problem with doing that in the gym, well then you got to keep that lifestyle up the rest of your life to keep those arms if you wish. Now that's great if you got the time, but a lot of people don't have the time. Give me 2 hours and we'll get your ripped arm. All right, so I don't want to do too much more there. So I'm going to do a final check on what we did here and just sculpt out a couple little areas. And now I'm going to move on to the hips. And then we're going to flip her and do the same thing for the other arm. patient got basically arm musculature while being asleep. She didn't have to exercise at all. So I did all the exercise for her. All right. VASER Hi-Def sculpting of the arm. There's her deltoid. Beautiful anatomy of the triceps and the biceps. And to get this anterior portion, I'm going to get that from the flip side. So I'm going to work on her hip, just kind of pretty straightforward. So you're more than welcome to watch me do the hip, but then we'll flip her over and do the other arm. And then when she's on her back, I'll get this anterior portion of this arm right in there. It sets up an aquatic medium for the ultrasound to work more frequently. Think of like a whale underwater, using its sonar to echolocate. The more water you have, the more that sound energy is going to travel. So it just makes it better for the VASER to work. Good. All right. So that's going to lead to a nice, well-defined muscular arm. You can sort of see how that's going to pop for her. Once that skin shrinks wrap around it, and she's going to get excellent results there. You see how the posterior deltoid, anterior deltoid, biceps and triceps, which is going to get excellent result in there. Okay. So now I'm just going to flip to the other side. So now what we're doing is VASER six-pack abs, or VASER high definition to the anterior abdominal wall. And this lady wants the three vertical lines, the line in the middle and the line on each side. This is the linea alba, medical term. And this is the semilunaris lines, the curvature lines here. So I've got to put in my tumescent, and now I'm going to use my VASER, which is going to melt the fat, and also it's going to heat the skin so it contracts really well. So I'm going to use the VASER here throughout the entire abdomen, and then we're going to really make her anterior abdominal wall pop. She previously had a tummy tuck, so the abdominal wall is pretty flat, there's no loose skin. And this is just going to make the muscles underneath really pop for her. And we'll come in here with the VASER. Again, emulsifying, exploding, using ultrasonic energy to blow up, to melt those fat cells. And then we're just going to come in and use our suction to suck out that fat and maximize that skin recoil for the patient. The three layers that I do when I do VASER, the deep layer, intermediate layer, and the subdermal layer. That hits all the pockets of fat and really gives you exceptional results if you do it right. And coming through fat here, those are the bubbles, you know, when the VASER sort of hits those rumbly areas, that's it going through prior scar tissue, prior fat, and it's just gliding through there like butter or margarine. And we're just melting that fat, emulsifying that fat, heating the skin from underneath, and that's going to give her really exceptionally good results here. Now we're right on top of the anterior abdominal wall. Here's our part right here.
1 minute?
And yes, please, 1 minute. And we're going to come in here and emulsify the fat, liquefy the fat, heat up the skin, and get her here a nice vertical line right in the middle. Very good. And then I promised this patient would also do the lower abdomen here. We're just going to come in here for maybe about, let's see what a minute looks like. This is the above the pubic region, and the tummy tuck left a little bit of fat behind, not too much, but just touch it up, make it look even a little bit more better. You can see it's starting to already pop out. Just gotta work at it and chisel it away. So come back in about half an hour, 45 minutes, and we'll be done.
So that's how I do VASER Hi-Def of the arms. VASER Hi-Def of the abdomen, getting her those 3 vertical lines, linea alba and semilunaris lines, as well as liposuction of the suprailiac crest of the love handles and liposuction of the inner thighs and the knees. So thanks for watching. Please join us next time and please subscribe.